It only took 2 weeks for the FDA to walk back its controversial refuse to file letter about Moderna's mRNA flu shot, and less than a month later, the man behind that decision, CBER head Vinay Prasad, has stepped down from his post. It seems like a pretty solid win for the Cambridge-based vaccine maker. But questions remain about why the incident occurred in the first place, as well as whether Moderna's other promising product, a combination flu-COVID shot that was just approved in the EU, will ever make its way to the US market. Things have been tough for vaccine makers, especially mRNA vaccine makers like Moderna, ever since vaccine skeptic Robert F. Kennedy Jr. became Secretary of Health and Human Services. Despite promising to support vaccine research in his confirmation hearing, the Secretary quickly moved to fire and replace the ACIP panel that makes vaccine recommendations, append the childhood vaccine schedule, and cut $500 million in mRNA funding. On February 3rd, the FDA sent Moderna a letter refusing to accept its marketing application for its mRNA-based seasonal flu vaccine, claiming that the company had used an inappropriate comparator group for its over 65 cohort. But this explanation rang hollow for Moderna and others in the industry, especially when Stat reported that Prasad overruled FDA reviewers and signed the RTF letter himself, which is highly unusual. Was this refusal just another move by HHS to scupper mRNA vaccines? The FDA pushed back on that explanation, telling The Hill that Kennedy played no part in the decision, but declining to comment on the reports that Prasad overruled his staff. Ultimately, Moderna and FDA got together and reached a compromise, seeking full approval in the 50 to 64 cohort and accelerated approval in the over 65 group while they generate additional efficacy data. It's impossible to know what role this incident played in Prasad's decision to depart his post after less than a year, especially given that the former CBER head was also in hot water over comments made about uniQure's AMT-130 gene therapy on a call with the media, comments that Congressman Jake Auchincloss alleged amounted to a criminal violation of the Trade Secrets Act. But either way, his departure should help restore some industry trust in the FDA damaged by this incident. While all this drama was happening in the US, the European Medicines Agency was approving mCombreax, the first combined flu-COVID shot in Europe. But don't expect to see mCombreax in the US anytime soon. Over in the States, Moderna withdrew its BLA for that same product back in May, saying that it was doing so in consultation with the FDA. At the time, Moderna said it would resubmit later that year, but as of mid-March, Pharmaforum has confirmed it still hasn't done so.